No, you can't go and talk. All right, so there's a difference between bad breath and halitosis, I'm told. We now have a seat in the dentist chair with Dr. Sharon Robinson to talk causes and, more importantly, prevention. Good morning. Welcome to Smile Jamaica.
Thanks for having me.
It's great for you to be here with us. What is halitosis?
Halitosis, commonly known as chronic bad breath. It's a condition in which persons emanates an unattractive odor of the mouth. What it's not, though, you mentioned earlier that there's a difference between both. Halitosis is not morning breath. Your daily morning breath is not halitosis.
Okay.
Nor is that 5 minutes of bad breath after you have a spicy meal or garlicky meal or a salad loaded with onions. That's not bad breath. Bad breath is persistent foul smell of the mouth.
You always have it.
That stays with you even after you're brushing, flossing, and cleaning with your tongue scraper.
What's that?
This is a tongue scraper. Many may not be familiar with this.
Well, I was not familiar with that.
There are variations to it, but it's very firm. And this is one of the number one areas where you have this specific bacteria, we call them volatile sulfur compounds. A lot of persons, it has that sulfuric smell, right? On the tongue, it's layered as a film. So this is your tongue scraper,
so you're suggesting that the regular toothbrush, because I use a toothbrush to what do you call it? To brush my tongue or clean my tongue. That's not good enough?
It's not good enough if you have chronic bad breath.
Okay.
You should add this to the list of things that you use at home.
All right, Doc, so let's talk about some of the causes.
Okay.
What are some of the causes of halitosis?
Sure. Let's look at it in three areas because there are many factors that will contribute to it. There's the oral factor being cavities, broken fillings, gum disease, and there are the diseases, respiratory diseases, we talked about that earlier, postnasal drip from chronic sinusitis or lung disease. Then there are dietary factors, onions, garlics, stuff that you eat that will trigger the foul odor of your mouth. One of the things we find is that persons are just not brushing properly. Let's think about this for a minute. The tooth has five surfaces. We frequently brush 3 and miss 2. The 2 being the contact spaces. Because we're not flossing those areas, we tend to miss that. So if we're to put this in perspective, I'd like to use an analogy my friend uses with his patients. Think of your body as a tooth, 5 sections. But I get to choose the 2 that you don't get to clean. So let me choose head and the midsection.
Well, never not be.
How long do you think it will take before you get into trouble? My point exactly.
Yeah, I understand.
My point exactly. So that's just to put it in perspective. Brushing for 2 minutes at least twice daily. Flossing. Rinse. Use an oral rinse. And for those with bad breath, this will be your best friend.
What about the other causes, as you mentioned? I don't know how you say it, like the teeth.
Gum disease?
Like it's impacted or something like that. You know, sometimes you see like one tooth on top of one or something like that. Would something like that cause it?
Yes. We talk about when teeth are impacted, meaning that they're not properly aligned, it's difficult for you to clean between teeth and their contact points. So you need to be under the care of a doctor. For many patients we recommend alignment, proper alignment. You see the orthodontist for that. Or you get your regular cleanings done inside the office. It is important that you do your regular checkups for that because you cannot manage it yourself at home. We'll talk about later in a few minutes about some of the things you can do at home that will help to mask the bad breath for a few hours and without coming to the dentist. There are things you can do at home that will help to mask
it. You should get rid of it though.
Right. The diseases, that's a different thing. That needs to be managed by your doctors. So we will say, for example, someone with a postnasal drip, You can't just, that won't go away unless you're being treated medically. For example, take some antibiotics, treat the source of the problem so that what's causing it as a symptom can still be managed.
Yeah.
As long as the source is still there, you'll always have the problem. Our mouth houses several hundred different species of bacteria.
Lord have mercy.
And they have nutritional preferences.
Several hundred.
Yes, yes, yes.
What does that mean? What do you mean several hundred?
That's the oral flora. Bacteria, our mouths are loaded with bacteria.
And it's caused
On
by
a
what?
normal.
The food that we eat,
No, it's just a normal part of your body flora, just like your intestinal tract. Just like you have good bacteria, you have bad bacteria. So they live there.
Yeah.
It's up to you now to be aware of things you can or things you should avoid. Now, under the healthiest conditions, your mouth is loaded with these bacteria. On top of that, you have gum disease. Now you're increasing the bacterial load of your mouth.
Yeah.
Cavities.
You have cavities. You're increasing the bacterial load of your mouth. You have abscesses in your mouth. So when you have these dental problems, you're now an overload. Now, saliva is very important for that. You see, God gives you these things for a purpose. Saliva you should consider as bacterial rinse agent. When we do certain things, like if you like coffee, alcohol, it tends to
Dry the mouth.
There you go. Dry mouth is favorable to bacterial growth. So it's important that you keep your mouth moist.
That could sound like if you just walk with some toothpaste in your mouth for the entire day.
If you can.
If you can, but you know what? Hydrate.
Yeah.
Because you guys are on set, you're talking a lot. You hydrate, have water, you drink. It happens to everyone. It's a common problem. The thing is, not everyone it's considered halitosis. Halitosis is chronic.
Yeah.
As speakers, you just find that after speaking, your mouth gets
Dries.
dries,
Tends to dry.
Yeah.
and your mouth tastes funny. You hydrate for that reason.
Great
Here,
stuff.
Landia, we must get water.
Unfortunately, we have to go, but great stuff. Thanks for coming.
Well, thanks for having me.
Yeah, man.
Tongue scraper.
Tongue scraper. Dr. Sharon Robinson here with us this morning. 10 minutes to your health. We'll do it again next Thursday. Stay with us, please. Soon come.
You must be there.